So hand-foot-mouth disease is actually a viral infection that's predominantly caused by two viruses. Coxsackie virus is kind of one of the more common viruses, as well as a specific type of enterovirus can cause this as well. Both of those viruses are kind of ingested orally by children, and usually the biggest population to get hand-foot-mouth are going to be children. It could be babies all the way up to toddlers. Generally, older children and adults do not get hand-foot-mouth. The incubation period is somewhere between 3 to 5 days, or it could be as long as 2 to 7 days. Generally, there is no blood work or test that we can do. Is based on what it looks like is how we make the diagnosis. And this condition can actually cause, when we talk about symptoms, it can cause different types of rashes on the body. It can cause everything from what we describe as vesicular, or kind of bumps that have what looks like fluid in them. And as the name implies, it involves primarily the mouth, as well as you can see the rashes on the palms of the hands and the bottom of the feet, as well as throughout the rest of the body. The rash can look a lot of different ways, but there's very few rashes that give you red bumps on the palms of the hands and the soles of the feet. You can get what we call herpangina, which is basically just sores or lesions involving the mouth. The symptoms besides the rash are fever. Sometimes it can cause these very painful ulcers in the mouth, which prevents children from wanting to drink. And then there is no treatment for it in terms of giving an antiviral medication. So it really does have to run its own course. Usually within about 7 to 10 days, a child that does have hand-foot-mouth will get better. And the biggest challenge that parents will have really is to make the child comfortable as best as possible. So that can be accomplished by giving Tylenol or Motrin for any type of pain as well as fever, and then really pushing a lot of fluids. And when we say fluids, colder fluids are probably more palatable than, say, the warmer fluids, but really it's whatever the child will drink is what you want to do. And then, again, usually there's no long-term complications from this, and you can get hand-foot-mouth on multiple occasions. So just because you get it once does not mean you can't get it again. But I think the real key to this illness is making sure that they're drinking plenty of fluids. Signs of dehydration in a child would be if the lips are dry and cracked, the inside of the mouth is dry, the eyes look sunken in. And then for some children, certainly those that are in the toddlers or babies, you can measure diapers. And if a baby is making half the normal amount of wet diapers, that's a sign that the baby's getting dehydrated. In that worst case scenario, if you suspect your child is suffering from dehydration, they should definitely be evaluated. Worst case scenario, they'll go to the hospital and get IV fluids, and then most likely stay in the hospital until they demonstrate that they can take things by mouth to avoid them getting further dehydrated. The virus can be shed in the stool, so you have to be really, really careful when you're obviously changing diapers, and obviously children that may not be wiping themselves properly and not doing proper sanitary precautions and washing their hands, and then all of a sudden their hands find their way to a toy, the toy finds its way to the mouth, and then all of a sudden you have infection in that way. I think certainly contact with the pediatrician is going to happen, because the sores of hand-foot-mouth generally make parents worried about it. And I think for confirmation, the pediatrician can make an accurate diagnosis based on presentation. But again, I think the things to remember is that this is a self-limited condition generally, and as long as we can avoid dehydration, which is the thing that will get a child most likely going to the hospital because they don't want to drink, the child should come through this illness fairly well.